Hello, hello. Welcome to Dying for Beauty. If you're here to hear the good, the bad, and the ugly about chasing beauty, you've come to the right place. Welcome to When Docs Talk, Dying for Beauty.
When docs talk, when docs talk, when docs talk, when docs talk. When docs talk, 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 when docs talk.
All right. Hello, everyone. Welcome to When Docs Talk, Dying for Beauty. I want to introduce you all to When Docs Talk. Some of you have been along with this ride with us, and some of you are new. So if you're new, what is When Docs Talk? We are a collective of doctors, nurses, nurse practitioners, physician's assistants, and several healthcare professionals who want to talk about different subjects, but through the lens that's not typically seen, through the lens of healthcare professionals, and also through the lens of women, many of us, in fact, all of us at this venture who are women of color. So welcome to When Docs Talk. I want to bring on the rest of the crew.
Hello, my name is Morgan. I am a registered nurse with a background in emergency medicine and psychiatric medicine. Welcome to When Docs Talk. We have a great show for you.
Sorry. This is Sonia Pinson, Dr. Pinson. I am from Georgia, originally Atlanta, and went into the Navy, did my tours, came back here in ATL, and family medicine is my trade. And I'm happy to be here with my friends. I haven't seen them for a while, so it's great to see beautiful, smiling faces, and they're going to have a great discussion. So I'm totally ready for that.
Hey guys, it's very good to see you all. This is Dr. Yulie Harrison Lloyd. I am from New Orleans, moved to Georgia after staying in Arkansas. I am a family medicine physician working in an urgent care setting, and so happy to be here with all of y'all, to be with you ladies again. It's been too long.
It has.
Hello, everybody. My name is Davita Bacon. I am a travel registered nurse. I specialize in emergency and trauma. I'm excited. I haven't been on this show in so long, so I'm excited to have this discussion and get to chit chat with all of the people that we invited to be here today.
And let me introduce myself to you. So I am a Didi Young Ipe Apo, also known as Didi, Dr. Edie Young, whatever rolls off the tongue. But When Docs Talk is a passion of mine. But when I'm not doing this, I am an emergency physician. I work in an emergency setting, and I am also board certified in internal medicine along with emergency medicine. I love public health and the intersections of how what we do, what we eat, what we breathe, and how we live impacts our health. And so that's another thing that kind of inspires this collective that we have here. I am a wife and a mother of three, and I am so excited to be here with you all talking about this because we've been meaning to talk about this for a while. Now, before we jump into it, if you're joining us for the first time, I want you to know that When Docs Talk is on Facebook, Instagram, and YouTube. So be sure to like, share, and subscribe to any of those channels. Welcome to When Docs Talk. All right. Let's jump in, ladies, and talk about what beauty means to you, because we've been meaning to have this conversation for a long time. This show was supposed to happen quite a few times before. I want you to define for me what you're thinking about when you talk about beauty. What's beauty?
Who can I go first?
Please go first.
Okay, come on. Okay, being a dark-skinned Black woman growing up in the South, I feel like I had to deal with a lot of um, other standards of beauty in the Black community. And when I had to come to my own, through college and just working, I evolved with my idea of beauty. So to me, baby, the Black woman is beauty. Okay. The natural hair, the full lips, the broad nose, the skin, the melanin, everything about a Black woman is beautiful to me. So you see me, okay? Okay.
And you are beautiful. I love it. Melanin popping. Let's do it. Morgan, what's beauty looking like to you?
Beauty to me is recognition. I guess when you have moments where you don't feel beautiful, you feel invisible. When you do feel beautiful and you're at your best, you feel recognized, you feel visible. So that's what beauty means to me. And again, I agree with my story is exactly the same as Davita's. In our community, what we look like is not necessarily the standard of beauty. So, I've embraced who I am. I've embraced what I look like, and I'm beautiful.
You are beautiful.
Thank
You are.
Absolutely. Absolutely. Yes.
All right. Who's next? Who's next? What's beauty? What's
Well,
beauty, Dr. Yuli? Oh, sorry, Dr. Sonia. Dr. P, bring me beauty.
well, no, 'cause I think, it's beauty is in the eye of the beholder.
Yeah,
So it's very, very subjective.
of course.
So even though I guess when it comes to social media, mainstream media, those kind of things, they try to create a standard. But from the standpoint of really what is beauty, and for me, I know it's about the eye and the aesthetics and that kind of thing, but also it's a matter of personality and who you are, how you act, how you navigate. I've seen some people that would not be considered beautiful, but because of who they are and what they do and how they shine, they're the most gorgeous people I've ever seen, even though they wouldn't necessarily be considered the standard of beauty. So for me, I think it's a little mixture of both. And unfortunately, I think that gets lost is the person's spirit and who they are.
100%. I love that. Dr. Yuli, what's beauty?
I really agree with what has been said. I feel like beauty isn't just surface. It has to be more of who the person is and who you are, because you can put all the Fenty beauty products and use all the Beyonce hair products on a pig that you want to. It's still a pig. You got to. It's not like. But no, it's. I think that beauty. I feel like you can't even describe beauty without talking about the person inside. But if you want to talk about aesthetically pleasing, that's what social media has done.
Yes.
So I have to agree, but I'm going to add a spin to it. I think beauty, to me, honestly, beauty is God in all of his creations. Okay, that's what's beautiful, and beauty to me, people are beautiful. And my cousins and some of my friends growing up used to always get on me. They're like, "Oh, you're so annoying," because whenever they ask me about is this person beautiful, is this person, I said yes, everyone is beautiful, because I truly believe that everyone has something beautiful about them, and it may not be what society tells us is beautiful. Maybe it can be that they're beautiful people inside. I think there's strength in beauty in what our bodies can do. That's part of what fascinates me as a physician. Like, wow, our bodies can do that. Women, moms out there, that's beautiful what we can do, holding these babies and delivering them. All of the things that we are as human beings, we can do as human beings, translates into beauty. And that goes down to the personality too, like Dr. P was saying, Dr. Penson. There are some people who may be gorgeous, but they are very not pretty inside. And it shows, it radiates. And I believe that how we take care of ourselves and that mind-body connection also defines beauty. When we feel beautiful, when we act beautiful, we are beautiful. So that's beauty to me. That's beauty to me. Yeah. So I want you all to talk a little bit more about this topic. So why do you think it's even important? Why are we sitting here on a Saturday night discussing beauty and beauty standards and cosmetic enhancement procedures and things like that? Why is this even an important topic?
I think it's important because I feel like now there are so many people are going to so many extremes to get what they think is beauty. I look at so many celebrities and I think they're beautiful as the way they are, and then in a few months they've had modifications done, and to me it wasn't even necessary. So what is beauty? What lens are we looking through to determine what beauty is?
Yeah, yeah.
I think a story that a lot of people, especially in the Black community, that can relate to is when K. Michelle came out and she said that she was getting injections done to make her butt look bigger. And then she ended up having so many health complications afterwards. And it's like, at what point do you determine is too much when it starts to compromise your health to look
Right.
a certain way?
Do you think that we're taking beauty too far in our society?
A lot of times, yes,
Absolutely.
I do. I think it's getting it's
Absolutely.
getting normalized, like especially like the BBL. Even the plastic surgeons that's performing these surgeries are telling you like this is a very high risk surgery. And a lot of people, like famous people, it's not just like the average Joe. These people have money, they have resources, they're undergoing these surgeries and they're dying from the surgeries or complications from the surgeries. And I don't think that enough light is being shed on exactly how fatal it can be. It's just like, oh, I just have to go. I'll be asleep for a few hours and I'll wake up. I got the body that I want. But to actually go into the details of the surgery and the complications and the risks involved, I don't think enough light has been shed on the subject.
I hear you. And
People
it's
don't
not
even
like
think it's really
everyone's
surgery.
right. I was going to say, it's not like everyone's dying from it. Certainly there's a lot of people who safely come out of surgeries and cosmetic procedures. But I think the question is, why are we as a society okay with that risk?
Because of the positive reinforcement. From the standpoint of look at who we hold up to standards of beauty and that kind of stuff. The women that are getting all of these surgeries. So why wouldn't somebody want to emulate that in order to say, hey, I'm beautiful too?
For sure.
That validation that they receive.
Yes, absolutely. Absolutely. So, I mean, that's very, very hard. If you already have some issues with your self-esteem, who you are, and then you see somebody and they're like, wow, look at what they've done. And they're held as being beautiful. Let me go do that. And it's easy in order to do that,
Right.
And Dr. P, I was to piggyback off of what you just said, the accessibility. You know what I mean? Like, it's everywhere. It's not that difficult anymore. You have advertisements of BBL on sale. Go to this country, go to this state. This doctor in Florida will give you this discount. You know what I mean? It's almost like getting your teeth fixed now.
Yeah.
Your hair implants.
Yes.
Yeah.
Wow. Getting your teeth fixed. So yeah, it sounds like it's just part of society now. It's like you said, getting your teeth fixed. Is there a problem with us looking at it like this, you think?
Well, I think maybe we're a little bit different because we also look at it medically. We see the complications when they come. We see the other side of it. So I think that also we're a little biased, I think, from that standpoint.
Well, I think that's why we have shows like this, right? Because we want people to see it from our lens as well. And I want our viewers to understand it's not, there are people in the medical industry who are also getting procedures and enhancements. It's not like them versus us, but we just see what can go wrong. And we also see how to do things safer, right? And so I think that's important as well. I want to just talk a little bit about some of the stats and facts with plastic surgery, cosmetic procedures in our country. And I want to, before I do that, underscore, it's not unique to modify our bodies for beauty. I mean, this is historical throughout all countries throughout the world. I mean, if you guys can remember, even down to the Elizabethan and Victorian eras where people would wear corsets so tight, they'd like pass out, their organs would be shifted. There are countries where people will bind their feet because smaller feet are considered beautiful. I would be way out of that class, and it was these big feet. And so there's lots of things that people have been doing, men and women, but especially women, right, for centuries in order to become beautiful. So we're not unique, but this is where we are here in the United States. Over 15 million cosmetic procedures are performed annually in the US, including surgical and minimally invasive treatments. The most popular procedures, can you all guess?
Botox.
No.
Nose job.
Nose job. Okay. Okay. So surgically, breast augmentation, liposuction, rhinoplasty. That's a nose job. Eyelid surgery and tummy tucks.
Mm.
Oh,
Okay.
that's even
Oh, the eyelids is coming through. Okay.
Wait a minute, eyelids.
Mm-hmm.
Yeah,
And
they
then
want their eyelids to be back there. They want to be able to see next week.
See?
she said, "See next week." Give me.
Oh,
And then minimally invasive. Hold up, minimally invasive Botox, which you all mentioned, dermal fillers, chemical peels, laser hair removal, and microdermabrasion. Okay. Then, in terms of plastic surgery, cosmetic procedures, women make up 92% of those, basically dominating the market. Okay, which makes sense if you think about it. A lot of times in our society, like it or not, a lot of women's validation is through their looks, and that's a whole nother discussion. But men are also increasingly opting for procedures like liposuction, rhinoplasty, and things like that. There's a lot of new advances in plastic surgery, which I hope that some of our specialists will talk about, and advancements in skin treatments and so forth. And in terms of social media, Instagram, TikTok is really driving the demand for certain looks. In fact, one of our guests has talked about how that is influencing even how her patients come in and what they ask for. Cost? Take a wild guess. Okay, I'll tell you.
okay.
So, they're expensive. The procedures tend to be expensive, especially when you're dealing with surgical procedures, and they're typically not covered by insurance. So things like breast augmentation can be $5,000 plus. Botox can be as low as $300-ish, depending on who's doing it. And we'll talk about how they're
$300 sounds cheap.
yeah, and then and go up to $1,000 per session. So it really depends. Okay, but the emerging trends in plastic surgery are things like tweakments, which is like natural looking results and just having a little thing done here and there. So that's increasingly more popular. So that's what's going on. You guys have told me what beauty is. You told me about how you think plastic surgery is just kind of being adopted into the mainstream. And cosmetic procedures, we just talked about what's going on in our country, the kind of minimally invasive things, and also the surgeries. With that, I want to bring on our first guest. So our first guest is Dr. China Steele Johnson. She is a board-certified dermatologist in the Atlanta area. She's a Harvard-trained dermatologist and focuses on cosmetic and aesthetic issues, providing expert solutions and performing procedures related to those issues. She is the owner of Steele Dermatology with 2 locations in Georgia, one in Buckhead and the other in Alpharetta. She's married to Mr. Theyre Johnson, and they have 2 adorable children. Dr. China says that she loves patient and community education and collaboration with colleagues, so she was happy to have the opportunity to join us today at When Docs Talk, and we are really happy to have her. Please welcome Dr. China Steele Johnson.
Welcome. We're so happy to have you.
So happy to be here.
Yes. Dr. China, Dr. Steele. She goes by Dr. Steele. I want you to weigh in because we were talking about beauty standards today, right? You heard us backstage, and I want you to weigh in on what you've seen and how modern standards of beauty are impacting your work and what you're doing with your patients.
Yeah, I think one of the biggest things I've seen is that people all want to look the same. And I think that's the issue. Like, you know, some of the most beautiful people or aesthetically pleasing people, if you will, are people who have unique features. And honestly, like part of their beauty is their uniqueness. It's like no one looks like them. And we've definitely gone way away from that ideal. And so that's where I try to get people to embrace their own features, like enhance your own beauty, like whatever features, characteristics that you have, like that's part of what we want to enhance and really celebrate, not necessarily try to give you the same lips as somebody else or the same cheeks as somebody else.
I love that you said that. Honestly, we were talking about this. I don't know with which one I was talking about this, but I feel like everyone's aspiring to the same person, just like you said.
Right.
Whereas before, even across cultures, there were different aesthetic
Yeah.
values, right? It used
Yes.
to be like, oh, in the Black community, this is considered beautiful.
Mhm.
In the Latina community, and this is beautiful. And, country by country, ethnicity by ethnicity. And now I feel like we're all looking to be the same person, whether we're Black, white, or in between, whatever. And so I agree. That's a problem because some of the most unique features that are not traditional beauty are so beautiful, right? Those noses that are just a little bit bigger, or maybe have a hook, those lips, even a smile that's a little crooked, that just makes you you. That can be so beautiful. So I agree.
And how do they respond to that when you have that discussion? If they come in and say, hey, you know what, this is what I want. And I
Right.
need this, or they have a picture of, okay, this is what I want to look like. I mean, and when you have that discussion, how do they respond?
Right. Well, thankfully, I have a following of patients that is more on the side of like, I still want to look like myself. I don't want to look like someone different. I don't want friends or colleagues to be looking at me and be like, okay, who are you? Or so my sort of tagline is subtle but significant. And so most of my patients are ones that want something that's a little more subtle. But some of the younger people, and I think that it does tend to be the younger people that are sort of wanting the same sort of features as somebody else, sometimes they'll go to where they can get it because they're sometimes so influenced by social media or peers or whoever they think their peers are in a cyber universe, that's sort of what's guiding them.
So they'll get it by any means necessary, is
Right.
what you're saying.
Right.
Are you seeing younger people coming in than you used to?
Yeah, for sure. There's this whole idea of prejuvenation. So whereas we used to think of rejuvenating the face, the younger and younger people, and I won't even get into like the obsession of little kids, and I mean little kids with skincare and things like that. But people in their 20s are really thinking about like, okay, do I need to get on an anti-aging routine? So a lot of it is trying to get them out of obsessing about things and really doing things that are age appropriate. Like I do think it's very good for people to kind of have it on their radar, but not go overboard with it. There's no need for a 20-year-old to be, thinking about what they need to do, to prevent
Wrinkles.
anti-aging, that sort of thing.
Yeah.
Okay. Fair enough. So I have, if nobody else has a question, I have a question because I want some of our viewers have asked just for us to break it down. Because we have viewers who are outside of the healthcare professions, of course. What exactly is dermatology? Like what is that? What issues do you address? What procedures do you do?
Yeah. So that's a good question. So, dermatology is the practice of medicine around the health of skin, hair, and nails. So, some of the most common things, especially in skin of color, is like acne, eczema, rashes, that and sometimes we do skin checks too. Skin cancer is not as common in skin color, but nonetheless, it does happen. So we want to keep an eye out for that. When it comes to nails, any sort of nail disorders, and we actually see a lot of hair loss. And then on the cosmetic side, cosmetic dermatology, if you really think about a lot of procedures, some of the more common procedures that are done non-surgically, it has to do with skin. And there is no better expert in skin than a dermatologist.
Okay, I have a question.
Yeah.
Well, as a dermatologist that works with people of color, melanated people, what are probably 3 tips that you would give anybody that would either work for hair, skin, and nails?
So one tip I would say is to pay attention, and one of the biggest things that I tell people, whether it's about their scalps or and hair loss, or whether it's about skin, kind of figure out what's normal for you. I think it's really important that everyone embraces like their own skin and feels comfortable in their skin. And so if your scalp is itchy, and that's not normal, like no matter what somebody tells you, like you should have like comfortable, healthy skin, hair, scalp, nails, all of that. Get comfortable with what your normal moles are. So that's the biggest way that you'll be able to tell if something is different, is if it kind of lies outside of your what's normal for you, because it could be normal for somebody else, but not normal for you. Secondly, I would definitely say for everyone to start early and start paying attention to things, sort of like on the cosmetic end of things, not to obsess. But we've been taught that black don't crack. And I think that that's caused a kind of odd phenomenon where people, if they start to see things in their skin that they're uncomfortable with, sometimes they'll be like, is it really, or should I care about this? And I'm like, we all care about how we look.
Yes.
So don't feel guilty, or sometimes people will be like, I'm just being vain, or, I know that, there are more important things. And they kind of almost put themselves down for even caring. And I'm like, no, we all care about the way that we look. That's why we do our hair. That's why we wear makeup. That's, why we do get our eyebrows done or have eyelashes or a number of things. And so there shouldn't be any shame around caring about how you look. And then the third thing, I think it's the secret's out, or at least the message is out. Black people, like, although we have melanin and protection from sun, we still age. And so we still need to wear sunscreen, and we still need to protect ourselves in the sun.
I'm glad you said that. Some of us are guilty of not protecting ourselves.
Okay, I would say
As well
that
as Miss Shan.
before I turned 30, I was never wearing sunscreen.
Right.
Religious.
Yeah, I think we give, there's definitely magic in melanin, but I think we give a little bit too much magic.
Yeah, we push
it.
it.
We push it. You're right.
Yeah.
That's right. We push it. We push it. You brought something up that I think we should really discuss. You talked about people feeling guilty or feeling ashamed. Do you, and I guess this is for all of us, but I especially want to hear from you, do you feel, Dr. Steele, that there's judgment in cosmetic procedures, and why, when it's so ingrained in our society now and it's just something everyone's doing at all ages, why is there still so much judgment or guilt?
It's funny. So when I see patients in their like 50s and 60s who are interested in cosmetic procedures, something that I hear often is, I can't believe I'm doing this. Like, oh my gosh, I can't believe I'm doing this. Because they grew up in a time where Black women especially did not participate or partake in these types of enhancements. And they weren't as advanced, 20 years ago as well. And then you have on the opposite end, the really young folks who are telling their moms and aunts and such, like, Mom, you need to go in and get something done. Like, and then I feel like people in my age group, like 40s and upper 30s, are somewhere in the middle. Like we're accepting of it. But sometimes you do hear that judgment, and people will say, sometimes I ask patients like, oh, did you tell anybody you're doing this? Or who did you tell you're doing this? And a lot of times they'll say like, oh, I told my one friend, or I told my sister, but I'm not going to tell such and such. And it's interesting too with men, because a lot of them don't want to tell their husbands. And I think that's usually because men have an idea in their head that someone who gets these sorts of procedures looks like overdone, like looks
Okay.
Sort of cartoonish, and they're like, I don't want you, don't come back home looking like,
A blow up
such and
doll.
such. Like,
Right.
so there's definitely a little judgment. And to be honest, a lot of husbands want their wives to look like themselves. So it's not
Yeah.
even coming from a negative place, but it does put a little sometimes shame on women when they're like, oh, I don't, I feel guilty about doing this.
Yeah. Hmm.
I wanted to ask a question in reference to people who are coming in for different types of hair removal.
Yeah.
Um, is this something that you are seeing an increase of, or I ask this because I know quite a few people with PCOS. I know people who have gone
Yeah.
and gotten the hair removed. I also know some people who have, accepted their facial hair. So have you
Yeah.
seen a change in the amount of people you're seeing coming in for that?
I don't know if it's changed. I think it's been a very popular thing for a long time, and I think it remains popular. And one thing I do want to address is a lot of times patients are like, I want to make sure it's safe, that I'm not going to get a burn, that it's safe for my skin color, it's safe for like our skin. And really, there are many lasers that are like exceptionally safe in the right hands for skin of color
Mhm.
for all shades, like from lightest to darkest, like really. There
Really?
are, so it as long as you're with an experienced provider. Now it is important to go to somewhere that has the right laser, because sometimes, if and this really only happens if you do like a Groupon or something like that. Sometimes people will say they can do laser hair removal, but they don't have the optimal laser for doing so. And so
Mhm.
you really want to make sure that they have like the correct wavelength, not just a wavelength that could be used.
Okay.
Yeah.
Fair enough. So I'm glad you answered that question, because there's a lot of people who have concerns about different dermatological procedures because they have darker skin. And
Hmm.
I would
so,
agree. I was
yeah.
definitely discouraged from getting laser hair removal because I am darker.
Hmm. Hmm.
Well,
Hmm.
the
They
other
said
thing
that
is,
the
how do people
contrast of the
research?
laser wasn't like too drastic enough in order to
Yeah.
completely, yeah. Mm.
And that's right. That is the issue. So, the way that a laser works is it targets chromophore. So it targets the pigment in
Mhm.
hair. So if the hair is not sufficiently different in color than the skin, then it may be difficult to do. Now, like I said, the lasers that are available nowadays and hopefully the people using them really have come a long way. So it is safe as long as it's the right laser and the right laser provider.
And
Gotcha.
how would you recommend that people or the guests that that are watching, like what would you say to them if they are pursuing certain procedures or even
'Cause
with the
I'm a woman.
laser?
Yeah.
Let me know
So,
so I know I can come to
so
Spiel
I
Cosmetic,
say,
okay?
so I say, of course, come to me or a dermatologist office, because many of us provide laser hair removal, or our estheticians do, or go somewhere that is a designated laser hair removal like business, because usually, because that's all they do, they have the right lasers, and they do, umpteen million people a month, a year, whatever. So they make sure that they have like the right people doing it and the right devices.
Awesome, awesome. So I want to actually just take a minute to talk about the natural side of this and tips that you have that people can do to
Mhm.
help their skin and their bodies.
Mhm.
Because I believe, like I said before, that beauty comes from within.
Yeah.
Um, what are some tips before we break to our next guest, bringing her on to join our discussion? Also, still with you. What are some tips you have for how people can naturally or health wise enhance their beauty?
Mhm.
So the skin is a body organ. So a lot of times when people are asking about like what foods they can eat, or what things they can do to improve the appearance of their skin, it's like all the same stuff that is good for health in general. So I think we all know that eating, fruits and vegetables and eating things that have antioxidants in them, minimizing processed foods, minimizing foods with unhealthy fats. Like those are all things that all go for improving the appearance of the skin as well. Now, I will say sometimes people rely a little bit too much on like, well, I know I don't drink enough water. The skin gets a lot of its hydration externally. So there's a term, the skin barrier. And sometimes we lose water if our skin barrier is disrupted. So it is important to moisturize and hydrate the skin externally, not just rely on drinking water. I say drinking water and eating healthily is great for our whole bodies, and that includes skin. But you do have to also do things from the outside so that it doesn't just rely on like ingesting the nutrients or ingesting the water. So it's really important to do, or collagen, that's become a popular one.
I was just about to ask you about that
Yeah.
too. It's been like a thing, like, okay, well, if you ingest collagen, whether it's like the powder or the pills,
Right.
it's not metabolized in a way that the skin is able to absorb it. So can you touch on that a little bit more?
Yeah. So now, now you can get collagen powder or whatever, like at every Target or like 7-Eleven. I mean, it's like everywhere. So, it's like how much can we rely on the integrity of that collagen and making sure that I tell everyone, and you guys already know this, but our viewers may not. It's sort of like it has to go through our digestive tract. It has to get absorbed properly. It has to get spit back out into our skin. And it's like, does that really happen? Or does this particular collagen powder really do that? And I remind them that collagen is in bones and ligaments and, arteries, like it's everywhere. So is it really ending up on the skin? My official is that it doesn't hurt. And some people swear by their collagen powder, and I don't know if it's placebo or not. So I say, keep taking your collagen powder. But the more reliable way to improve collagen in the skin is to give our skin the building blocks that it needs to make our own collagen, which would be like retinoids and peptide serums and growth factors that are really in skincare products.
Awesome. Well, we're going to take a quick break and bring on our next guest. But before we take that break, I just want to put this up because you talked a little bit about water and how people know that, they need to drink more water, but water is also external. You have to take water in through your skin, which is an organ, and we also should be drinking water. And so, I want people to understand that not all water is created equal. Most of us don't drink. How many of you guys drink tap water?
Absolutely not.
No, Davina said absolutely not. Okay, nobody raised their hand. Yeah. So most of us are drinking like bottled waters and all this fancy water that they sell at the store. And there's a big push towards like alkaline water and so forth. And I just want to say that there are studies that show that that alkalized water or waters that have higher pH could potentially benefit us. And are more readily absorbed. There are actually studies that show that hydrogen-rich water that's created not by adding more baking soda or chemically altering it can help with certain things like inflammation. And there might even be some studies that show anxiety, diabetes, all these things. It's not quite proven, but we know that drinking water is good for us. And we know that we have to watch the kind of water that we drink. And we know that we have to hydrate from within as well as we do on the outside. So if you're interested in learning more about the different types of water and how water can change your life and change how things are absorbed in your body, go ahead and DM me at ADDYoungIPAAPO, either on Facebook or on Instagram. Okay. But that said, I do want to get our next guest ready. You are here with When Docs Talk for Dying to Beauty, Dying for Beauty. And we're talking about beauty standards, plastic surgery, cosmetic surgery, and all the procedures. And we have our guest here, Dr. China Steele Johnson, but we'd like to bring on another guest right now. And that is the lovely Miss Brianne Burrows. She is a project manager for an indulgent chocolate company that she's been with for over 5 years. She received her bachelor's degree in business from Georgia State University. She is 32 years old and a New York native, but has been residing in Atlanta for over 20 years. In her free times, she enjoys cooking, baking, and spending time with family and friends. When asked why she was passionate about joining us on the episode, she tells us that she has been a recipient of cosmetic surgery and that she believes that people deserve to hear the good, bad, and ugly about having a cosmetic procedure performed. So I'd like you all to give a warm welcome to Ms. Brianne Burrows.
Thank you for being here today.
Welcome.
You're on mute, dear.
I'm so sorry. Hi, everybody. Thank you for having me.
Hi. Welcome.
Thank you.
So I'm happy that you were able to join us because you're coming from a perspective of somebody who has had procedures done. And so I want you to answer the same question we're asking kind of everyone. We've asked our WDT crew, we've asked Dr. Steele. We want to know what your ideas or what your thoughts on modern day beauty standards are and how that impacted your decisions perhaps to get any sort of procedures.
Okay. So after me getting the procedure that I got, which I got a lipo 360 and BBL, I learned that there's beauty in everything, but not everybody sees your beauty. And with that being said, me growing up, I was introduced into social media and making posts and getting negative feedback from the way that you look in your pictures and everything like that. Even when it came down to me being around family and friends and people cracking jokes, and, you know, you might laugh in the moment, but then you go home that night and you're like, and then of course you start seeing ads and specials and you're like, I don't think this thing is too far away from me. I think I can accomplish this. So I definitely think that being on social media had a heavy influence on the decision that I made.
Fair enough. Fair enough.
I have a question. Do you feel that after you got your procedure that it made you, like internally, it made you feel more confident?
It did make me feel more confident in a way, because essentially when I first got the procedure, I knew how I wanted to look whenever I took a picture or I took a video, because prior to the procedure, if you were to take a picture or a video of me, you had to get me from the neck up. I didn't want anybody to see my waistline, my back, a side shot, anything. After I got the procedure, I actually developed a different insecurity where it turned into, okay, well, how do I look? Do I look okay? You know, or you might see somebody that may have like what they call a botch job. And you're like, well, do I look like that? And I hope I'm not going out in public. Or you might hear somebody giggling and you're like, are they talking about me? Or, you know, are they just talking amongst each other and just having a good time? So at certain times it does give me confidence because I did get the shape that I wanted. But on the other side, it just developed a whole different insecurity.
Okay.
Well,
let me ask you from the standpoint of kind of how did you research and decide which surgeon that you were going to go to? Because just to kind of, I guess, let people know ahead of what you're going to answer, you are here in the Atlanta area, but you went to Miami in order to get your procedure. So how did you end up finding your surgeon and deciding, yes, that's the one that I want to go to?
There is an app called Real Self. So I downloaded that app, and on that app, it's essentially a whole bunch of people, you know, just normal people who get different types of cosmetic surgeries. And you can go on the app and you can search different procedures. They'll post pictures. They'll tell you their experience. They'll name the doctors. And then, so I was on there and I was looking at different reviews, and then Dr. Fisher popped up. So I went to his website, started reading his background work and seeing a lot of positive reviews and everything from him. And that's how I ultimately made the decision. I knew that I wanted to be somewhere that was a little closer to home because I live in Atlanta. So me going somewhere like California, that's a 3 or 4 hour flight, or me going out of the country to get a procedure done, I just wasn't willing to take that risk. And I felt like me going to Miami was kind of like a safe place for me.
I hear you. We're going to elaborate a little bit more on your story. And I'm glad you mentioned that there is something called medical tourism, where people literally leave the country to go to have different sort of medical procedures. Oftentimes they're plastic surgeries or cosmetic surgeries and so forth. But you mentioned how you found your surgeon essentially. And I wanted to just bring the conversation back to Dr. Steele, because I'm curious, with all these different apps that people have to find the right healthcare professional to do these procedures, I want to get your take on some of the people outside of, say, medicine who are doing procedures that you do, for instance. And I think that's an issue that we need to address, because I want to know from somebody who's trained in doing it what the difference is and how our patients or our viewers might be skewed in one direction based on ads and apps.
So one thing that I definitely want to bring up is because a lot of not only people outside of medicine are doing cosmetic procedures, but also non-cosmetic doctors are doing cosmetic procedures. So a lot of times I'll see where somebody says board certified doctor performing whatever procedure. And the key question is, what are you board certified in? So you may be a board certified family practitioner, which is great for practicing, internal medicine and family practice, but people know that that is tricking patients into thinking that they have gone through a residency or fellowship in that particular area. So definitely figure out like what they are board certified in, and you can Google it. I mean, because it should be part of their CV, exactly where they did residency, where they did fellowship, all that sort of stuff. And then the other thing is, I think doing your research is great because like you went to Real Self, you have other people giving reviews and giving other patients, previous patients. And I think that that's super helpful. The other thing to think about is on social media is people only show you what they're choosing to. So I had a patient who was so in love with this doctor on social media and went and got something done, and it was like fillers or something, and she was like so disappointed when she came back that it didn't look like all the rest of the ones that she saw, and she paid a lot of money. But she also went to California. And so I think you were really smart, Brianne, to go somewhere a little bit closer because she wasn't going to pay to go back out to California if she had an issue. Or whatever. So just remember, like, not just to use social media or not just to even use their website, because then people are only showing you what they're choosing to show you, and really make sure that you vet them by some other like objective measure.
Well, I am really thankful for some of the tips that you've shared, not only on how to take care of ourselves and also the kind of things that doctors like yourself do, but also how to best choose who to do these procedures and how to safely do them. Dr. Steele, I want you to give our viewers some last minute tips from you as a dermatologist on how they can best proceed with looking beautiful.
Yeah, so I know we talked a little bit about it earlier, but just to kind of like hit some of those notes again. Number one, don't feel guilty about it. Like, making sure that you are happy with the way that you look in the mirror, not the way that somebody else sees you, not the way that, you measure up to, someone else's sort of standards or how many likes you're getting. Like, don't use those as a measure. But really, if there's something that's bugging you, go ahead and see if it's something that could be addressed. And as long as it's something that you're comfortable with, then go ahead and go for it. The other thing that is really important for all areas of medicine and all areas of life is consistency. So I say, don't just do things right before your birthday, reunion, anniversary, or
Yeah.
or going out of town. Make sure that you're putting your health, including your skin health and your cosmetic health, at the forefront throughout the year, because ultimately you want to be that person that people say, like, you always look so good. You keep it together. That's kind of what most people know that they want. They don't want the, like, oh, you look really different today.
Right.
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 Consistency. And again, I think consistency is the key to succeeding in health in general.
Wonderful. Dr. Steele, Dr. China, thank you so much for joining us. We really
Thank
appreciate
you.
your insight, and we hope that you'll join us again because we have more questions for you.
Good. Sounds good.
Thank you so much.
Thank you.
Mm-hmm.
Thank you. All right. And so now we are going to bring on our next guest, who was able to join us virtually through an interview she did with us a few days ago. And we're going to put her up and tell you a little bit more about her. And I'm talking about none other than Dr. Aisha Baron. She is a board certified plastic and reconstructive surgeon who is practicing in the Atlanta area. She attended Spelman College, where she graduated cum laude with a Bachelor of Science in Biology, and then completed her medical education at Meharry Medical College in Nashville, Tennessee, where she graduated magna cum laude and matched into the highly competitive field of plastic and reconstructive surgery at Baylor College of Medicine. At Baylor, she was actually the first African-American female resident in plastic surgery. Dr. Baron is fully trained in plastic and reconstructive surgery and has a special interest in breast cancer reconstruction and cosmetic breast and body contouring, delivering the natural but noticeable results. She has earned the nickname Breast and Body Doc due to her expertise in reconstructive and aesthetic surgery, and her surgical skill has been witnessed nationwide in the hit reality TV show Atlanta Plastic on Lifetime. She is a mother to 4 children and believes that while beauty is in the eye of the beholder, ultimately it's in the hands of your surgeon. So I have her exclusive interview with myself and Dr. Yuli. Here we go. Okay, I'm so excited to be here today. We have with us Dr. Aisha Baron in the house, and she is a specialist in mommy makeovers and a trained breast reconstructive microsurgeon. So we are so blessed to have her expertise and have her join in on this conversation.
Thank you so much. It's definitely an honor to be available and for you guys to even think of me to contribute to this conversation.
Awesome.
Oh,
So,
absolutely.
Yolanda brought her on. Yolanda, how did you know this lovely, talented lady?
So many moon ago, back when I was still doing my tincture in rural Arkansas, she is one of the people who actually was amused by some of my antics, and she and I just began talking, and I was like, you know what, you're one of the coolest folks I know. And she and my husband actually do have something in common as far as the medical history with lymphoma and cancer. So that's kind of sort of how things kind of rolled up, and now I just love her. She is so my girl crush. I love her to bits.
Anyway, we're really excited about this topic. We've been trying to do it for years, right? Like, we wanted to talk about this because everyone's talking about it, right? And when I
Mhm.
say everybody, behind closed doors, people are trading secrets. Who do you go see to get what? What are you doing to wear? And so
Mhm.
cosmetic and plastic surgery, reconstructive surgery, all that has now become part of the fiber of our society.
Yep.
It's not a thing only for the wealthy. I think back in the day, only if you had money and you were in Hollywood could you afford to do things like that, or would you even want to? But would
Right.
you say that it's becoming more mainstream, Dr. Aisha?
Oh, absolutely. It has become mainstream. So there's no more becoming. It is here, and it is here to stay. I think with shows initially in like I want to say like late '90s or early 2000s. I want to
Yeah.
say like Dr. 90210, The Swan, shows like
Mm,
Nip Tuck, things like that. They have, or Extreme Makeover was one, I think, as well.
yeah.
Those were the shows that really kind of pioneered bringing plastic surgery into your living room.
Yep.
And then, there was another show that some of y'all might have seen called
Mhm.
Atlanta Plastic. I don't know, on Lifetime.
I've heard of
You
it,
might
and
have
I've heard
seen.
that you were the star of it.
I was one of the featured plastic surgeons, but I was actually the first Black female plastic surgeon to be featured on a reality TV show. That headlined a plastic
Yeah.
surgery reality TV show. So
Yes, yes,
probably I
yes.
just
And you got the
color pop.
double snap. I
But
love it. I love
it
it.
showed. Yeah, so there were shows like that that really brought plastic surgery into your living room. And the reality TV shows really showed that okay, that not only the wealthy get plastic surgery. The majority of my patients are middle class,
Mhm.
and they will save up to have a procedure as opposed to take a vacation that year or upgrade something. They'll upgrade their bodies instead,
Right.
So aside from the TV shows that have been out there, there's also social media presence, so and also willingness of celebrities to share what they've gotten done. Before it was just very, very hush hush. Like you would be up there, in the grocery store aisle with looking at the National
Yes.
Enquirer or whoever, trying to speculate who had
What
plastic
they
surgery
did,
or
like, oh, I think
whatever.
her nose looks different. Oh, she looks like
Exactly,
yeah.
exactly. But now they are very forthcoming, and I think celebrities have played a huge role in destigmatizing plastic surgery. Social media has played a huge role, just because we get to share sort of the day-to-day, operations of being in the plastic surgery field. Patients can share their experiences firsthand, and really the way in which social media has transformed the really marketing industry,
Yes.
and that you could really be at the fingertips of your desired audience at any moment has really, really changed the game when it comes to plastic surgery exposure.
I could definitely see that. I felt it. We've watched it. It's
Yeah.
evolved. What do you think
Hmm.
is
I love it.
still one of the biggest misconceptions about plastic surgery?
I think the biggest misconception that I think still is here that you kind of say is that only rich people can do it. Only you have to have thousands and thousands and thousands of dollars in order to have surgery done, or to improve a portion of your body. Not necessarily. If you do it responsibly, it can be affordable for a lot of people. Other misconceptions are that when you have plastic surgery, that it has to be very noticeable. Like, it's going to transform your face. You're going to look so different. And, our tagline at my office is natural but noticeable. Okay. So
Natural but noticeable.
I like to produce
Mhm.
natural appearing results, but they're still a little bit noticeable that you can know that these things were improved. Not noticeable to where you walk into a room and your breasts enter before you do, or anything like that. But I think a lot of people think, oh, okay, well, if you had plastic surgery, then you have a BBL out to here, your breasts are out to here, your nose looks crazy, you look very plastic, you're too plump, you're overfilled, that whole type of thing. The majority of plastic surgery patients do not look like that. So you have the bell curve, of the
Yeah.
spectrum of how people can land. And most of those people land within the middle. You have your extreme ones, you know, in which you're like, oh my gosh, you know, she's in the office or he's in the office like every day. And then, you know, you have the majority of people in the middle in which they've had something done and you might not be able to tell.
Right. Right.
I wanted to ask, with you mentioned kind of what social media presence has done for plastic surgery. Do you find that there has been a shift in the, I guess, the mean age of the person who is seeking plastic surgery?
Great
Absolutely,
question.
absolutely. So, and that can be a, you know, a good and a bad thing sometimes. I think, you know, with social media being at everybody's fingertips, and really when you have the majority of the younger population that consumes social media, then you're going to have this content that is reaching people who are in a younger age demographic. So, you know, the majority of patients that I see, you know, are female. I do treat male patients, but most of them are between like 18 and 65. Okay. But when you talk about the ones that maybe contact us on social media or, you know, have seen our social media posts or things like that, that it's probably going to be more so in the 18 to maybe like 35, 40, you know, 45 age range.
And I always wonder to myself, with somebody who is like like you're an amazing surgeon, you obviously care for your patient. Your face literally lit up when you talked about the confidence that you see in some of your patients after their procedures. So I always wonder, what is the threshold? What's the limit? Who do certain surgeons turn away? And with you, I'm curious to know, which patients would you be like, we're not doing this?
There's a lot of them.
There's a lot of them.
I will not hesitate to say no at all. Okay. If, you know, the vibe's not right sometimes, you know, I'll be like, you know, I'll tell my patient coordinator, I don't want to operate on this person. Like, you know, like we're not doing that. But most of the time it's patients who, have poor attitudes. You know, if you come in and your attitude is just nasty and you're mean to the staff and things like that, but you're fine with me, you know, I really try to, you know, feel those people out. And a lot of times I'll be like, no, because if they're mean to the staff, like before surgery, after surgery, they're just gonna, you know, they're gonna cut up, you know.
Of course, they're in pain, they're in vulnerability states.
Yeah. Yeah, exactly. Right. Patients who have unrealistic expectations, you know, if they are coming in with a picture of, you know, Serena Williams and, you know, their BMI is like crazy or something like that, you know, like things that you can't get from A to B, you know, like it's sometimes I can talk patients into accepting what the result will be, you know, based on their body type or what they have going on or what my limitations are. You know, it's like I'm a plastic surgeon, not a magician. Sometimes, although I like to think sometimes I am, but
Harry Potter style.
you know, but you know, you have to set the expectations, or if I feel like they're not doing it for the right reasons, you know. It's you have to have the right motivations. Like plastic surgery is not going to get your man back. It's not going to get you the right girl. It's not gonna elevate your job necessarily. I mean, some things might improve, you know, if it helps to improve like your confidence and if you're doing it for you and not for anybody else, like those are, you know, those are things that we really have to feel out. Like there's a whole kind of like psychological consultation that goes on at the same simultaneously as I'm getting information from the patient. Yes. You know, and so, and then also, you know, if our goals don't realign. So if I tell a patient that you need a tummy tuck, and they don't want to have a tummy tuck and they just want to have, you know, liposuction, but they have a ton of stretch marks. They have really, really loose skin. You know, I don't think liposuction is, you know, in that potential patient is really going to give you the results you desire. And I don't feel comfortable, you know, performing that operation because you're not going to be happy with it. You know, so, and if they're very, you know, if they give a lot of pushback on it, then I'm like, okay, you probably are not the one for, you know, well, actually, I don't put it on them. I say, you know what? I can't meet your expectations. It's me, not you.
It's me, not you.
Yeah, it's me, not you. So.
One of the things that myself, and I know that DD sees as well, is these patients who go elsewhere to get their procedures, whether it's elsewhere within the United States or insert country here, and then they come back in what my opinion is, way too early. Like if you got insert surgery here on Thursday and Friday you're in the ER with a complication. What is your opinion on these patients who are, dare I say, irresponsibly going out and getting the surgery? Not necessarily, oh, the procedure you want, that's something you shouldn't desire, but the care that they take of themselves or not take of themselves afterwards.
Right.
Yeah.
So I would say if you're going to have plastic surgery outside of the city that you live in, so even within the United States, outside of the United States, you need to be financially prepared to either stay so that you can follow up adequately with your surgeon, or go back and visit so you can follow up adequately with your surgeon. I see patients out of town all the time. I have out of town patients. We do virtual consultations initially, and then they come and see me in person so that I can feel and, examine them. But I'm not meeting them the day before surgery. That does not happen in my practice. Normally it's at least a month prior to surgery so that we can check your labs, make sure all the planning is aligned. But I tell patients who come in from out of town, like, if you cannot come back at these follow-up points, I'm not your surgeon. Like, I don't like to be ghosted after we've developed the very intimate. Listen, the relationship, and I say this all the time, the relationship between a surgeon and a patient is extremely intimate. I see parts of you that nobody will ever see, ever. So I don't take that lightly, and you're not gonna ghost me after I've been all up in your business. Yes. So in regards to people who go out of the United States, in hopes of having an operation and come right back, it's irresponsible to me. Number one, like, depending on the procedure that you've had, flying the next day after a general anesthetic is probably not the best idea. Right. Or traveling a very long way after having a general anesthetic as well is not the best idea. And then, I think a lot of them potentially feel like, okay, well, I'll just have my surgery here and then I'm gonna go to the ER, and y'all experience that.
Yes.
They show up in the ER
all the time.
They show up in the ER and they're like, okay, I need my drain removed, or I have an infection, or whatever, this doesn't feel right, or whatever. Well, you should be following up with your surgeon. And so I think it just really puts them at a disservice. It is irresponsible, even financially, because you feel like you're saving a buck by going to this other location that has a cheaper rate, less dollars for surgery or whatever. But if you end up having a complication, you're going to pay like threefold or, quadruple or whatever you paid over there, because you're going to come over here. If you don't have insurance, then, and it's no guarantee that your insurance will cover any of it either, because you just had a cosmetic surgery. And so you'll then need people to care for you. And so it's just not the responsible way to do it. You need to be able to follow up with your surgeon.
Honestly, this has been so informative even for me. And I'm so happy that we were able to have you and your expertise. I want you to give our viewers some last minute tips. What are some last minute words that you want to share? Any advice, anything about this topic of plastic and cosmetic procedures, about beauty standards? What kind of knowledge are you going to drop on our viewers?
I would tell them that, really kind of, if you're interested in plastic surgery procedures or improving your appearance, do some research, have the conversation, talk to your friends. Sometimes people will kind of, gatekeep a little bit, but if you mention it, then they'll say, oh yeah, I did that, or or didn't do that, or whatever. Talk about it, and really get the information that you need so that you can go into it as an informed decision maker. What else? Don't smoke.
Don't smoke. I love how you put it. A third time. Don't smoke.
Yeah, you know, if you are interested in losing weight prior to surgery, try to get within about 10 to 15 pounds of your goal weight. Your results will just look better, and they'll hold up a little bit longer. Prior to surgery. So there's so many things. There's so many things. I wish I could tell you guys. And if patients or potential patients or your viewers have any questions, just comment on my Instagram. You can find me at Breast and Body Doc. My practice is Breast Body Beauty, Plastic and Reconstructive Surgery. You can find us on Instagram at Breast Body Beauty. I love to answer questions. I love to, talk about all things plastic surgery, being a mom, that whole type of thing. So, we're at your disposal if you have any questions.
That was great. I love that interview, Linda. Thank you so much for finding her and bringing her,
I was smiling the entire time.
Yes, yes.
She's such a great person. She's got a great spirit, and she practices from her heart. And a lot of people, at least for me, when I went into medical school and I thought plastic surgery, I didn't think about, the way that the patients are going to feel afterwards, which is like the goal, right? All you hear about is cha-ching, 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 cha-ching.
Mm-hmm.
Money, money, money. Go into plastic surgery and you'll make buku buck. But it's good to see, the human side of it.
Yeah,
Absolutely.
I agree.
Speaking about that human side, I want to talk a little bit about the human side and the people who have experienced it, because we talk about it a lot from the perspective of healthcare professionals. And we've had Brienne, she told us a little bit about her story. I'm going to want her to share more with our viewers, but I want to get the stories of people who have been under the knife or had procedures, what it's been like, what was the recovery like. And one of our first guests that I'm going to bring on is going to be joining us from outside of the show. So we're going to make sure her audio is good. I want to introduce her first, and then she's going to tell us a little bit about her story. And that is Miss Rhodesha Johnson. Now, Rhodesha has been in the nursing field, a nurse herself, for 16 years. This includes roles in nursing management and leadership. And now she is a nurse entrepreneur, and in the past 2 years has been operating an IV hydration business here in Atlanta. She herself has had elective surgery and reconstructive plastic surgery. And she's going to tell you the difference about the two and her experiences within both of those fields. And she wanted to join today to give WDT and our viewers her perspective of cosmetic surgery from the lens of a healthcare provider and as someone who's experienced these surgeries. So let's welcome Rhodesha. Rhodesha, are you on?
I am. Can you ladies hear me well?
Yes.
Yes, we can hear you very well.
Oh, wonderful. Thank you all for having me tonight.
It's a pleasure. Tell us a little bit about your experiences. Tell us about some of your surgeries. Share with our viewers a little bit more.
So, I actually plan to have elective cosmetic or plastic surgery for a long time. When I was about 30 years old is when I started doing research into the different procedures and different surgeons in the area. In my mind at that time, I wanted a tummy tuck. I had 2 children, one via C-section. So we all know when you get cut, things just don't heal right the way they're supposed to all the time. And I also wanted, at the time, I thought I wanted breast implants. And so at around 30, I started, doing the research. I started saving my money for the procedures and things like that. And at age 37 is when I started going to consultations. And that was very interesting to me because I saw someone, I saw the first surgeon, and he was okay. Very popular surgeon in the Atlanta area. And everything I said I wanted, he said he would do. And he also added some things that he thought I should get. I went to the second consultation, and this doctor, he didn't, suggest anything additional, but he did, agree to do what I wanted to have done. And I don't know why, even though I booked with this particular surgeon, but in the time between the consultation and the actual surgery, I went to a third surgeon for a consultation. And that's where I found the one who I knew was meant to do my surgery. At the time, he made me feel very comfortable. He answered all my questions. He gave me information, that I didn't come across during my research. And another thing that I really, really liked about him is that he was so adamant about me doing the right things leading up to the surgery, like getting clearance from my pulmonologist because I have asthma. He had me get clearance from my GI doc because I had GERD, things like that. But the biggest thing was when he said to me, Radisha, you don't need implants. Look at your breast. You have enough tissue. Now, at the time, I didn't even know because, in my mind, I'm just thinking, my breasts were hanging, and I thought that the implant would be what solved it. But he said, no, you have absolutely enough breast tissue. All you need is a breast lift. And just trust me, and you are going to love your results. And he was 100% correct. And so from that perspective, I kind of feel like, in a way, I feel like, if you want to have something done, by all means, go do it. But be informed and be prepared. But also pick somebody that you can trust so that you get the results that you want. If I had gotten implants on top of an already size F breast, I would not have been pleased with the result. But because he suggested that I get a lift instead of the implant, I had the result that I wanted. And then, so at that time, I had a tummy tuck and a breast lift in 2013. Okay. And then fast forward a few years later, in 2021, I was diagnosed with breast cancer. And so I went down the path of having to do reconstructive surgery on my breast. So that was another experience that I had with plastic surgery.
I see. So you had that experience of having it more for cosmetic reasons, and then had the experience of being a breast cancer survivor and having it as a reconstructive type procedure. Is that right?
Correct.
Okay. What, before I bring back on Brianne to tell her story, and then actually one of our WDT crew, what advice would you give to viewers in terms of either before surgery, looking for a person, or recovery? And I think recovery is something that a lot of viewers have questions about. Like, what does it mean to go through this process?
So before surgery, you definitely want to be in the best shape that you can be in. Mm-hmm. If you need to lose some weight, then lose the weight. If you need to start exercising, start exercising. Weight training so that your recovery is better. Having a tummy tuck, oh my gosh, it was so strenuous. It does a lot to your body. And if you are not in good shape, your recovery is going to, it's not going to go as well as you would expect. I also joined Real Self. I heard Brianne mention that earlier, and that was really beneficial for me because a lot of people told their stories, again, along the lines of what you just asked, things to do before, during, and after. So definitely before the surgery, do your research, know what it is that you want, find a surgeon that you're comfortable with and one that you can trust and who's not just going to take your money and do whatever it is that you want to do, because they can look at you and see the after before we can. I would say for recovery, be prepared to, the last physician or surgeon I heard her mention about having follow-up appointments and things like that. I definitely would not recommend going somewhere out of the country or out of the state where you can't have those follow-up appointments. And I say that too, based on my personal experience. I had a complication from my tummy tuck and had to see my surgeon several times after that until it was resolved. And my results were really good. And a lot of people that knew me and knew that I had it done, they also went to the same surgeon. And well, some of them went to a different surgeon, I'll say that. But to me, it just seems like you can't count out that something won't happen afterwards. So I say definitely, once you find that surgeon that you can trust, have it be someone local so that if anything does happen, you can get the proper treatment that you need. and not have to pay out of pocket for it.
Absolutely. Well, Rhodesha, we really appreciate your insight and also your stories. Thank you for sharing your stories. We will definitely want to have you back. I know that right now you're in the matrix. We call it in the matrix because we can't really see you, but we're glad we were able at least to hear your story. And I'm going to invite, I'm going to keep you on the line, but I'll invite our other guests back on. Brienne, we want to hear a little bit more about your story. We did hear about the kind of decisions that went into you deciding that you wanted to have a procedure and how you chose your surgeon. We want to talk a little bit about the process and what it looked like after, especially having it in a city that's outside of where you reside.
Okay. So first of all, it was very expensive. The procedure itself was $13,000. And then I had to factor in flying down there, staying in a hotel. He wanted me to stay for 8 days. I stayed for 10 just to be sure that I was going to be okay. I had to make sure that I had money to eat the proper foods for me to eat. They only gave me a few lymphatic massages to help me out. And after that, I was completely on my own for paying for somebody to give me those massages, which ultimately was very expensive. So in total for the procedure, I spent about like $20,000 total to get the procedure done. And like I said, I stayed there for 10 days because I wanted to be sure that when I left Miami that I was clear, I was feeling good, I was walking okay, and I was feeling so good to the point where I went to the airport. I walked through the entire Miami airport and I did not get in a wheelchair. I did not have to have any assistance or anything. And I got on that plane and I came home.
Wow. It sounds really smart, right? Like you really wanted to make, you're like, I'm going to be for sure. I'm not going to be out there.
He said 8, I said 10.
That's right. Sounds like to me. Yeah. And that's what's up, because honestly, you don't want to be in a predicament where you run into trouble and there's no one who can help you.
Correct.
You know?
Correct.
Davita, you have a story for us too.
Oh, I do, honey. Okay, so anybody that knew me before know I've always had big breasts. So I decided 2022 that I was going, no, 2023, I was going to get a breast reduction because my back was hurting. My boobs were so heavy. I was like in the F. And if you were to see me in person, like full body, baby, I'm not that big. I'm like 5'3", 350 pounds, and my boobs were just heavy. Okay. So I actually was referred to somebody from somebody else that I knew. They had about the same size breast that I had. We're about the same size. And she had a wonderful experience with this doctor. I didn't have such a great experience. It wasn't a bad experience, but I really wish, because I went to Miami. I flew into Miami. Me and my wife went to Miami, and I think like the day before, I had to go in and turn in my paperwork because I have asthma, so I had to get cleared by the pulmonologist. Had to get like EKGs, tests done, mammogram, all this stuff, right? So they're very thorough in like the preliminary examination process. And I felt like when I got there, it was like, how can I explain this? It was like an assembly line.
Oh,
That's what I would, that's exactly how I would describe it. It was an assembly line.
so you felt like a something on a factory line, like assembly line, just
Yes,
no,
absolutely.
personable. So not good is what it sounds like.
I did, that part was so impersonable. Like it was like literally 20 something girls. So it's a waiting room. So you have to go in and speak to several people, give them your documentation, get things signed off. You talk to the well, not your surgeon, but you talk like to a nurse, a tech, the concierge person that takes all your documentation, scan it, and uploads into a file. But when it comes to actual surgery day, and you see the doctor for the first time, it was not the best experience.
Mm.
Um, Even when it went to like me going in, like I get, marked up, whatever. I'm like, I'm so excited. I'm like, my breasts are finally gonna be small. So I had big boobs my entire life, but it like when I got in like my late 20s, early 30s, that's when it started to like hurt my back. And so I knew I had to do something. And it wasn't covered by insurance because the insurance, in order for them to cover it with insurance, it was going to be like 2 years.
Why? Why 2 years? Why did they tell you 2 years?
Because the process of you get the referral from your PCP,
Mm-hmm.
and then the appointment date may not even be for another 6 months, and then for them to actually put in for you to see the plastic surgeon would be another 6 months. And then for you to get a surgery date would be longer than that. So that part, I was like, you know what? I'm just gonna pay for it out of pocket.
Right.
So that's why I decided to go with this surgeon, go there. I will say, because the approach that he did as far as not doing stitches that need to be removed, it was more like, you know how like you approximate incisions and then do like the stair strips and stuff? That's what
Yeah.
he did. So I did not have to go back. After I had my surgery, I never went back to the office. I never
Wow.
went back. Yes.
So you didn't have any follow up with anybody after your
No
surgery?
follow up. They called and said like, "How you doing, girl?" I'm straight. Okay, cool. Call us back if you need something.
So that was
They said it just like that too, right? They said it just like that. How you doing, girl?
Yes. They
it
did
wasn't like you
call.
didn't go. It was a matter they just planned it that way. No follow up.
That's exactly. I think that they were intentional about doing it that way.
Hmm.
So I think that it, because of the way the process was, in order for me to do like the intake process and like follow up, I'm pretty sure it'd be way more than what it was for the intake process. So I think they were intentional about just like, okay, if we do this, then less people come back, so we don't have to see these many people. And
Oh.
I would, if I were to do, because they always say after you get a breast reduction, your boobs grow back. They did.
Really?
They're not as big as they were, but they definitely grew back since like post op.
Mm.
And I would say that I would never go to the office again. For other women that are looking
You would
to,
never go to that office again, you mean?
I wouldn't go to their office, right?
Oh.
But I would consider getting another breast reduction, only because it's just not proportional to my body. And when I first got my breast reduction, like everybody else was saying, like I felt confident. I was like, oh my gosh, it makes me look like I wanted to look my entire life. And I was just happy with the results. I will say recovery was hell.
Mm-hmm.
I was not able to lift anything over like what 10 pounds. I was not able to lift my hands over my shoulders. I had to sleep upright. So I had to get like these little pillows. I wasn't able to bend over. It's very intensive with the aftercare. The easy part is going under the knife, honey, because you go to sleep, you wake up.
Mm.
But it's the aftercare to make sure that you don't develop an infection or any complication. You, even if you try your best to do, like avoid any complications, by happenstance, it could still happen.
It could happen.
I
Yep.
was fortunate, right? I was fortunate enough to not have any complications, but I know people that did everything right and still have complications. So I don't think that it's anything that people should not consider. Because even when Brianne was talking about like, baby, he said 8, but I said 10. I was out like they said, oh, you don't have to follow up, but I still stayed out there just in case I need to come and see you.
Mm-hmm.
I don't need to be in the vicinity, okay?
Mm-hmm.
But fortunately enough, I was not having any complications. I was able to leave like, I think originally they told me I could leave the day after, but I stayed for like a week.
Oh, we.
And like I said, my wife was able to help me with my massages, and she showered me. Baby, I wasn't even able to like clean myself. So just that, like when people consider going into like some type of cosmetic procedure, because it was considered to be a cosmetic procedure because it wasn't medically clear for me to do that under my insurance. It's very, very hard. Like
Yeah.
even just
Yeah.
going through the process and even relying on other people to do things for you. Because you don't realize how much you can't do things until you're like, I didn't ask this person 50 million times to do this. Like I feel bad. Like it's
Yeah.
that puts you in a different mental space too.
Yeah.
But
I think
How long
Brienne
are
is
you out
you're
of
kind of
court?
nodding your head. You agree, huh?
you understand
I
it.
agree 1000%. Um, you really need the support around you in order for you to survive. When I got the procedure done, I literally felt like I got hit by a car. And simple stuff like getting up to go to the bathroom when I had to use the bathroom and having to try and sit down or take a shower or just walk a couple of steps because I was afraid I might get blood clots in my legs. I wanted to get up and walk around and, they had to feed me. I didn't want to eat. I didn't want to drink. But even having them there to remind me, like, you have to eat food. You have to take your medication. You have to make sure you stay hydrated. It was really important to make sure you had a good support system.
Yeah. And when my friend, because I was her BBL massager, I flew out there and we was in the house and I was doing everything. I really understood like how painful it can be because like the simplest things that she was trying to do, and she was just like wincing at the pain. I was like, okay, let me do this. I'm over there holding a pea cup to her, like, baby, I got you. Nurses, okay, come on, I got you.
Right. Well, I hope that everyone's hearing this because honestly, when we think about plastic surgery or cosmetic procedures, we think about the outcome, and you all are describing some of the pain that comes with it. Not being able to pee on your own, not being able to lift things, lift your arms above your head. So that kind of takes out the glamour from it. And
Right.
so, I heard you, Davita, you said you would do it again.
I would.
Brienne, would you do it again?
I would not do it again.
Really?
I wouldn't. It was that was the most painful thing I've ever experienced in my life. And not only the pain, it took me a really long time to recover. They usually say women, start moving around and walking between 4 to 6 weeks. I literally was on week number 5, and my mom was coming to the house to peel me up and make me move around and try to have some type of normal life again. And I think that because, like I said, you go into it looking for a certain level of confidence, and you might get that confidence, and then a different type of insecurity comes up. So then I slipped into a depression where I didn't want to leave the house anymore. I felt safer and more comfortable at home. I didn't want to travel. I didn't want people to look at me and possibly notice that I had a procedure done, or for people who knew me to see me, because it was such a drastic change. I knew that if they see me, they would immediately be like, girl, what happened to you? You used to be a flat
I've been
bag.
working out.
You were scared of the judgment?
Definitely the judgment. So I personally, I wouldn't go through the procedure again. And by the grace of God, I don't even have to go through the procedure again. I went in there, he did what he needed to do, and I don't need any more. I am good where I'm at.
Good, baby. I'm good.
I'm good. I'm phenomenal. I'm good.
Awesome. Rodisha, are you still with us here?
I am.
How about you? Any last words? Final, would I do it? Wouldn't I do it again? Weigh in.
I would definitely do it again if I had to. But I would do, and one thing I would do different is I would not break my tummy tuck. People do not know that you can break your tummy tuck. If you gain too much weight, it's gonna look like nothing ever happened. But on the other side of that, when you do lose weight again, your stomach does go right back flat how it was. When you exercise and you drop the weight, it's a snapback. You get it back. But if you gain weight, it's gonna look like, I wasted my money.
Oh, wow. It's so funny. You always hear, or at least I always hear, with liposuction for sure, that will grow back. Go ahead and eat enough, it'll grow back. But I, for some reason, didn't realize that even with a tummy tuck, that you could break, as you call it, break your tummy tuck. So thank you for sharing that with us, because I don't know if a lot of people knew that.
Yes, you'll notice people who've had tummy tucks, if they gain weight, where the actual tuck is on the lower abdomen, that part stays flat. But then you get that fat in your upper abdomen, which is not good
they're
because it's around your
bulbs.
heart and your other organs and things like that. And a lot of people, don't realize it, but you can look at people sometimes and tell, oh, she's had a tummy tuck, because the bottom part of the abdomen will still be flat, but the top will be looking like something that belongs on another person.
That belongs on another person. So it's not a fupa. It's not a fupa. It's an upper fupa. Okay. Got it. Well, Rhodesha and Brianne, thank you so much for sharing your short stories. Davida, thank you for sharing yours, but you're not going anywhere because we're going to close and leave some last minute thoughts with our guests. But I want to really say thank you for being open with our viewers, for showing them all the sides of this world of getting plastic surgery, what it looks like to look for someone, what happened during your procedure, after your procedure, and being honest about whether you do it again. We really have learned a lot from your experiences, and I'm sure our viewers have too. So thank you so much.
Thank you all. Thank you.
Thank you for being here, Brianne.
Thank you for having
Yes,
me.
absolutely. Thank you.
All right. So we're going to close things out. Ladies, what last minute thoughts do you have for our viewers? What have you gleaned from this? Is there anything that you would consider now that you've heard from our experts, and things that you would never consider now that you've heard from our experts? Talk to me.
Dr. Steele, I'm coming for you. Okay, because obviously you will want somebody that has your best interest if they are the one that's putting you under. And I mean, not necessarily saying I'm going to get like another breast reduction anytime soon or any like major things, but even with her just like shedding some insight on the laser hair removal and how I was deterred years ago, because the last time I had even checked in with this was probably like 10 years ago when it was like becoming popular. And now hearing that, like, okay, well, yeah, back in the day, that's how it was. But now that we have like up-to-date lasers that are able to like, if you have the right laser, she's able to do the procedure that I need her to do.
Right.
That was, affirming for me, because as a woman, as a dark-skinned woman that, just wants hairless skin, that's reaffirming to me. I love that. And I'm gonna check her out, and I hope she remember me from this podcast. I mean, from this show.
And you'll tell her. You'll bring the video. You'll be like, remember how we were? You see this video?
Friends and family discount.
Cool. Anyone else?
Well, I think for me, the way that it was presented tonight, I think sometimes I have to admit, once again, we see a lot of the negative aspects of it, with the complications and that kind of stuff. But just knowing that if you do it the right way, with research, finding the right person to do the procedures, it actually can be, a good thing for a person if that's really truly what they want. So I'm hoping that people, when they see this show, that they really think about, okay, yeah, I can do this, but maybe also trying to do it the right way. And so I'm hoping that people will now know, hey, I didn't know the app that Brianna, that she was talking about. That was like, wow, so I think that's the thing that, I guess all apps or social media isn't bad, because you actually can use it for good and for information. So
Sure.
I think for me, seeing Dr. Aisha talk, and seeing someone that looked like me and really takes her patients' concerns and desires into consideration. It's not just about the buck. She really cares about what the patient wants and aligns her values with the patient's values to get the best outcome. That was comforting for me, because I've considered plastic surgery in the past, but I've always been a little afraid that of the outcome, and doctors that want to give you more than what you asked for. But she gave me a little bit more hope.
Cool.
I also chime in on both Dr. Steele and Dr. Baron what they talked with us about. And, I have PCOS, and hirsutism, or facial hair
Same.
growth, is almost like part of it. So I would love very much so to not look like one of the three little pigs with hair on my chin chin chin. And today has really helped out with that. Now, as far as the boobs, I would love to have a breast reduction, but I'm in my 40s at this point. I have two small kids. Recovery like that just ain't gonna happen in the Lloyd household. So I'm gonna just make these big suckers part of my workout. Let's get it.
That being I'm forward.
You talk about the fears and things like that. Somebody else mentioned the fears of bad outcomes in terms of how it looks. I personally have fears in terms of like dying. Like, I can't have my story be that my kids lost their mom because I was trying to be fine. Like, you know what I mean? So that is one of my biggest concerns. And I mentioned it to Dr. Aisha in our interview. And by the way, the full interview will be on our YouTube channel and our Facebook channel, as well as our Instagram channel, because that was an edited version. So you can tune in and see that. But she talks about how there's really, if you go to somebody that you've researched well, that is well trained, and that is the mantra of the day. Training is important. There's a reason why people get these degrees and certifications, that the complications are generally rare.
Right.
It doesn't mean that they don't happen. And even if you do have a complication, it doesn't mean you had a bad surgeon, right? Things happen to people during these procedures. But I have learned a lot about the procedures themselves from a perspective of the people doing them, from the people who have had them. Usually when I hear about these procedures, I see the aftermath in the emergency department if there's a complication, right? And there's tons of people who don't end up in the ER, right? So my perspective might somewhat be skewed, but I do love also how our experts that we had on today look like us. Because a lot of times when it comes to the health and beauty industry, especially the beauty industry, people who are more darkly pigmented, like ourselves, we don't get all the scoop. We don't get all the considerations. A lot of the research is not done on us and so forth. And so now that we have people who are going into those fields, they're advocating for people who may have more pigment. And so it's really amazing to hear from them, hear the changes in the technology, hear what we can get, what we can't get. And that really stood out to me too. But in general, my whole thing is, as much as we're talking about how to safely do this, I have to ask and wonder, is it a good thing that we are a society that is normalizing this? Is it good because now we have all these technologies, or do we have to sometimes step back a little bit and say, hey, are we focusing on the wrong things, right? Because a lot of you mentioned to us that inner beauty is really important. And it's great that we have options for outer beauty, but what are we doing to address who we are as people and as a society? That's my question. You know what I'm saying?
Yeah.
That's a good question.
Because you can't inject some of those things, right?
Right.
You can't insert or implant.
Yeah, ugly is ugly.
Ugly is ugly, especially when it's coming from in here, right? So, but in the end, I am happy that we live in an age where we can do things to stay a little younger for longer. We can do things to stay beautiful. But I just want us all to remember what beauty is. It's not all this all the time. Sometimes it's in here. And so as long as we keep that in mind, then let's go ahead and use all the technologies and all the things that we have available to us, because, we're trying to stay young forever.
Safely.
Yes, please, safely.
Yeah.
Viewers,
Make
I want
sure
to
the
thank
thighs
you guys.
match. Make sure the thighs match.
Make your thighs match. You guys are crazy. See, I love these ladies. It's been awesome getting together with you all again and talking about this. Viewers, I hope you've learned something. I hope that you were able to ask some of your questions. Please know that we can always answer your questions if you go ahead and post them on our When Docs Talk page on Facebook, also on Instagram. We can answer your questions. We can reach out to our experts who joined us, and even our guests who shared their stories are really forthcoming, and they can answer any questions that you have. Until we meet next time, stay beautiful inside and out, and stay safe. Thank you so much for joining us today on When Docs Talk, Dying for Beauty. We'll see you next time.
When dogs talk, when dogs talk, when dogs talk, when dogs talk. When ducks talk, when ducks talk. When ducks talk, when ducks talk.